Welcome to Courage Kenny. We are happy to have you here as our new nurses. Here at Courage Kenny, we have procedures in place to help limit falls after surgery. As one of our nurses, it is your job to follow these guidelines and help keep our patients safe. Every one of our patients has a risk for falling. It is our job to categorize them and decide what level of precautions each person needs. Here's a sample list of patients. I want you to look over their medications and check for medications that will make them less alert. Check for patients who are NPO or who have had a history of falls. After you receive report from the discharge unit, you can assess your patient for the ability to respond appropriately to instruction. This will also impact the fall interventions they need.
After you guys have a chance to look over the patient list, I'll take you into a patient's room and I'll show you some of the fall precaution interventions that we have here on the unit.
Okay. All right, everyone, let's come into Mrs. Johnson's room.
Hi, Ms. Johnson.
Hello. This is Miss Melba Johnson, and she has agreed to let our new nurses learn from her today.
It's been so long since there's been visitors. I've been waiting for this moment.
Oh,
We can all drink together for your new celebration.
well, that
of
is very
nurses.
generous of you, Miss Johnson. I'm going to put your name on this and put it in your fridge.
Oh, we'll have it later.
Sure. All right. So Mrs. Johnson is recovering from hip surgery, and as you know, all of our patients here are at risk for falls. So for her, we have our standard precautions. We have her call light, and we have her mat there on the ground, you can see. If Miss Johnson had dementia, she does not have dementia, but if she did, then we could wheel in a camera, which would video her and be able to watch her, and if she tried to get up unassisted, it would talk to her and ask her to stay back in bed and to push her call light so a nurse could be with her. If she has dementia and does not respond appropriately to direction, then we would put a chair in her room or outside her door so that she could be supervised one-on-one, and that way they could assist her if she tried to get up or help her to call her nurse. Any questions about that?
No. So a few of the risk factors for Ms. Johnson that put her at risk for falls would be her recent hip surgery has resulted in some limited mobility. She's also in pain and takes some other medications that have side effects that could affect her ability to ambulate independently safely. So Nurse Eleanor, can you tell us about some interventions that we do here to help prevent patient falls?
Sure. We can ensure her environment is free of hazards with like cords and clutters. We can place it on the table.
Good catch, Nurse Eleanor.
Yeah, and we're gonna make sure her water and her call light are within arm's reach. There you go.
Thank you.
You're welcome.
Nurse Emily, how about you?
We need to make sure she has the proper assistive devices like a walker and wheelchair and a gait belt. Where's the gait belt? In here, like that. And we also need to make sure that the bed alarms and chair alarms are on and working.
Great. It's also really important that we continually assess our patients for confusion, changes in their level of consciousness, or any reports of dizziness.
Nurse Hyatt, what education could you provide to Mrs. Johnson?
Okay, I'll teach that falls are common after surgery, but it can be prevented through some steps like using call lights when she needs something, and also changing position slowly and making sure all the security alarms are turned on.
That's excellent, thank you. You are all going to make great nurses on this unit. Thank you, Mrs. Johnson.
Raise a glass, ladies.
Bye, Miss Johnson.
Bye.
This is my true form.
Tighter, just so that you can fit a couple fingers through.
I want to cinch that waist up a bit. I used to be a 16.
Oh, you are right.
That's great.
Was that filming?